Where successful healthcare innovation is taking place and cutting-edge thinking is being applied to wellness and prevention, we want to shine a spotlight. So it is a privilege for me to present the HLC Wellness Frontiers Award to the Community Care of North Carolina and your President and CEO, Alan Dobson. And so this is the award.
I can't think of anybody better to receive this award than Community Care, and I can't think of an organization that's done more to promote what Community Care stands for than the Healthcare Leadership Council.
Community Care of North Carolina is a collaboration of healthcare professionals, physicians, hospitals, and other providers. We have put additional resources in the community to help them take care of patients, like care managers, clinical pharmacists. We send people wherever they have to be. This is all, one patient at a time.
It's very critical that we do a much better job in prevention so that our system really isn't what some would call a sick care system, that we really turn it around and become more of a wellness system.
When a client goes to the ED, I get an alert. And so then I call the patient up to just try to build rapport and just let them know, hi, I'm a nurse with Medicaid and I wanted to follow up with you just to see how things were going.
Who's not taking their medication correctly? Who's been to the emergency room that the primary care doctor didn't know about? Who has failed to follow up with their cardiologist?
What we found out was that we were going to be able to do better with them if we helped them navigate the health system, if we helped them with things like behavioral health and a number of interventions which were really specific to that small population.
Over the years, we've gotten even smarter. We've been able to take the population and look at risk and risk adjust it and try to do some predicting of who do we need to spend more time with, who's at risk of getting sicker, being in the hospital, that if we did something, we would prevent a readmission or an additional hospitalization.
A lot of them would fall through the cracks. We do a lot of coordination and collaboration with the different care providers, such as bringing discharge summaries from the hospital to the primary care physicians and informing them of changes made in the hospital that they might not be aware of.
We also go to doctor's appointments with the client as well too, because sometimes they get to the doctor's office and they're afraid of, what to tell a doctor, but while I'm in there with them, this is what's going on with the client, so we have a better communication, and they stay out the hospital.
It's not that we're all consumed with cost, it's that we understand that if we have the optimal outcome, then the cost takes care of itself.
One of the areas that we're focusing on now is wellness and prevention. Almost 80 cents out of every dollar that we're spending on health care goes to treating preventable chronic disease.
If we really want to fix healthcare, we have to empower the people who actually are caring for the patients in the communities where they're caring for them.
Things like medication management, making sure that they get to their appointments on time and have appropriate access are the kinds of things that allow us to keep them relatively well and out of the hospital.
The collaboration of providers, the focus that comes from the community care network towards those chronic diseases that if we can just manage them better, we reduce the cost and we drastically change the health outcome for the patients.
By really doing even minimal interventions and doing a better job at coordinating people's care and doing early interventions, we can make a big difference, not in their lives today, that's certainly important, but also in the long term.
We have novel ways of looking at how to try to maintain their health over time, things like disease management, patient navigation through complex systems. CCNC has really helped us with both ends of that spectrum.
If we improve care, we improve quality, savings will accrue. And I can tell you, having run the Medicaid program, that's exactly the case. That works. And what's happening is other payers and other employers are saying, I would like my employees to get that level of personalized care.
So it really is a way to target our resources better and get better outcomes, improve the quality of care and the quality of life for many Americans.